friends, in this video we are going to look how a letter's content and pattern will change when the receiver or reader becomes changed. And if you didn't subscribe my channel yet, please subscribe, like and share it. And it is better for you to take a pen and make some notes, so it will help you a lot when you can go through it. So it will be beneficial for you to write a letter later. And please don't skip video as you won't get a clear picture of this comparison. So let's look how it will differ when a reader will change and the content is same. So here is the writing task. Then your position is given. You are a charge nurse in Good Shepherd Hospital. Then the patient name is Miss Elizabeth and she is age 75. Then the medical history, what all diseases she had, and then the social history. So we can see, first we have to look the reader who is the receiver. So according to that we can include the relevant data from this one. So let's look the next page. Then here it has mentioned about her reason for admission, because fall from upstairs, and what all procedures has done, and then her progress in the following days, and what all things happened to her during hospitalization. Next comes the management and what all medication has given and what's the discharge plan. So first let's look writing task. Using the information in the case note, write a letter of referral to Dr. Matthew Philip, psychiatrist, Royal Perth Hospital, Sydney, for assessment and further treatment. He visits Good Shepherd Hospital twice in a week. So we should think about whether it is a known case for him or is it just a referral for him. So according to that also our letter will be different. As you know, if it's a known case, we don't want to mention any past medical history or social history because he knows that patient very well. So just include the current details, the reason for admission, and also sometimes he knows he's the one referred him to this hospital. So what has happened during this period only he doesn't know. So that is the one only should include this letter. Then the next one is write a letter of referral to Miss Agnes Joy, dietitian, Good Shepherd Hospital, Sydney, for dietary advices to manage diabetes and obesity. Then the third one, write a letter of referral to Physiotherapist, Physiotherapy Center, Sydney, explaining the use of assistive devices and to assist him in physical exercise to improve his mobility. Then the last one is write a letter to the in charge of Victoria Nursing Home who will be responsible for Elizabeth's continued care. So according to the receiver we should change the content, and let's see in detail. So first the letter is going to the psychiatrist, so we should think what all history we have to include, whether he should know the patient is hypertensive, diabetes, like that. BPAD, I had done one video before regarding the common abbreviations which is used in the OET letter or speaking, even it can help you. And that is, so you should know what is BPAD, that is bipolar affective disorder. So if you don't know the full form, so it will be difficult for you to write the letter, even the meaning will be changed. So if you write irrelevant information it can affect your marks. So just try to practice daily. You can practice at least 10 abbreviations, so later on you will be have a good set of abbreviations, so it will be easy for you to tackle this exam. Then this failed suicidal attempt So just go through this letter and pick up what is relevant for a psychiatrist. Just imagine you are a psychiatrist and just think what all things I have to include in this letter. If I am a psychiatrist, what I have to know. Then regarding social history also, what all things I should know. Then even upon admission, the history and the sciences treatment, it all differs according to the receiver. So end of this video, I am going to provide 3 sample letters, so it will be easy for you to get an awareness regarding this type of letters. So and you can practice that one, so you may get good score in OET writing task. Okay, all the best for your endeavor. Just keep watching on it and practice it very well. Thank you very much.